Hi, we are from Group B. We will be sharing on the topic of young-onset Parkinson's disease and its management. Let's have a look at it.
Evening, it's me, Sini.
And it's me, Jamie, and you are watching Medical Spotlight. Let us have a glance at the headlines first. Parkinson's disease getting younger? What is Parkinson's disease? Without further ado, let us hop into the overview of this disease. Parkinson's disease is a degenerative condition of the brain associated with motor symptoms such as slow movement, tremors, rigidity, imbalance, and other complications which include cognitive impairment, mental health disorders, sleep disorders, pain, and sensory disturbance. As the disease progresses, people show difficulty talking and walking.
Young-onset Parkinson's disease, or YOPD, however, is when a person is diagnosed with Parkinson's disease with an age younger than 50 years old.
More men than women are affected by this condition. Whereas in Malaysia, there are at least 20,000 people in Malaysia who suffers from Parkinson's disease, and this number is expected to increase fivefold by 2040.
This is George. He suffers from Parkinson's disease at a young age and has been consistently referred to his doctor, Dr. Q, for treatment. Let's see what Dr. Q get to offer us.
Hi everyone, I'm Dr. Q. George is one of my patients. But don't worry, currently his disease is under control with proper medications and management. I believe you are interested in George's case and want to know more about YOPD. Before introducing the medication and management available for this disease, I would like to share some possible causes or risk factors of this disease. The exact cause of YOPD is unknown. However, genetic mutations are believed to play a role in YOPD. According to studies, mutations in genes such as PRKN, SNCA, PARK2, PINK1, and LRRK2 are believed to lead to an increased likelihood of developing YOPD. Next, exposure to certain toxins or environmental factors such as well water consumption, pesticides and herbicides exposure, as well as certain neurotoxins may increase the risk of later Parkinson's disease, but the risk is small. The presence of Lewy bodies is also believed to cause young-onset Parkinsonism. Lewy bodies are clumps of specific substances within brain cells that are microscopic markers of Parkinson's disease. Although many substances are found within Lewy bodies, scientists believe that alpha-synuclein, which can be found in Lewy bodies in clump form, may lead to YOPD. However, further research is required to identify and analyze the possible cause of YOPD. Now, let's look at the symptoms of young-onset Parkinson's disease. The symptoms that appear in YOPD are similar to the classical symptoms of late-onset Parkinson's disease, or LOPD, but some clinical features seem to be more prominent in YOPD, such as muscle stiffness and levodopa-induced dyskinesia, which will be further discussed later on. Bear in mind that the progression of the symptoms is lower in YOPD than LOPD. Similar to the usual Parkinson's disease, loss of muscle control is one of the most well-known symptoms of YOPD. Today, scientists are aware that YOPD can manifest itself in a variety of ways and not just as problems with motor function. Basically, the symptoms are divided into two parts, which are motor-related symptoms or movement-related symptoms, and also non-motor symptoms. Firstly, let's look at the motor-related symptoms, which are also called movement-related symptoms. The major symptoms that we can see are movement slowdown, also known as bradykinesia, and muscle tremor. Patients must experience bradykinesia in order for Parkinson's disease to be diagnosed. People who experience it describe their muscles as being weak, but there is actually no loss of strength. Instead, it's caused by issues with muscle control. Other than that, they might feel muscular tremors while at rest that are less common in YOPD than LOPD. About 80% of people with Parkinson's disease experience this regular shaking of their muscles even when they are not actively moving. Essential tremors, which rarely occur when muscles are at rest, are distinct from resting tremors. In addition, Parkinson's disease also commonly manifests as cogwheel and lead pipe rigidity, but is more common in YOPD compared to LOPD. Last but not least, tiny or crowded handwriting, also known as micrographia, which results from poor muscular control, is also another motor symptoms of Parkinson's disease. On the other hand, they also experience non-motor symptoms that may be related to other diseases such as Alzheimer's disease. The first non-motor symptom is depression that is more common and followed by sleep problems. This is caused by rapid eye movement or REM behavior disorder and also restless legs syndrome. Other than that, patients with Parkinson's disease will experience loss of sense of smell or anosmia and also gastrointestinal issues, orthostatic hypotension, which refers to low blood pressure when standing up, constipation, as well as sexual dysfunction, categorized as signs of the autonomic nervous system.
The symptoms sound worse. So what can we do to help YOPD patients survive? Definitely, we have the solution. It is therapy and management. It included pharmacological treatment, non-pharmacological treatment, and alternative treatment. Let's have a look at the first one, which is pharmacological treatments. Bear in mind that we are treating a young patient. The treatment given should not cause complications for them. Due to that, we consider dopamine receptor agonists as first-line treatment for YOPD. It consists of pramiprazole, propranolol, and apomorphine. How do they work? They stimulate dopamine receptors in the brain, which then help to reduce the symptoms like tremors, stiffness, and slowness of movement. Not only that, they also can help to improve balance and coordination and may slow the progression of the disease. It sounds good, right? However, the side effects come in package. Patients with dopamine receptor agonists may experience side effects like nausea and vomiting, postural hypotension, confusion, and hallucination. Patients are advised to not stand up too quickly and should be careful when driving or doing activities that require alertness. If patients cannot tolerate dopamine receptor agonists, they can try monoamine oxidase MAO-B inhibitors such as sertraline. It increases dopamine levels in the brain by inhibiting the activity of the enzyme MAO-B. It also prevents the breakdown of neurotransmitters by preventing the inactivation of monoamines, enabling the neurotransmitter to diffuse into the synaptic space. Do take note that monoamine oxidase inhibitors can cause dangerous interactions with certain foods and beverages. Please avoid tyramine-rich food such as aged cheeses, soy sauce, miso, and tofu while taking monoamine oxidase MAO-B inhibitors. Alcohol intake should be reduced as well. Other side effects include insomnia, hypotension, mood changes, and headaches. Furthermore, for YOPD, the patient can be given levodopa, which is the precursor to dopamine. Not like other cases of Parkinson's disease, levodopa is not recommended as first-line treatment for YOPD patients as it causes more complications for young patients. Alright, so how does levodopa reduce the risk of YOPD? Levodopa restores dopaminergic neurotransmitters in the brain by entering the brain using amino acid transporters. It is then converted to dopamine by an enzyme called dopa decarboxylase. Concomitant use with peripheral dopa decarboxylase inhibitors such as carbidopa and benserazide help to increase the bioavailability of levodopa as well as decrease its side effects. The more effective the drug is, the more severe the side effects. Same goes with levodopa. It causes dyskinesia, tachycardia, anorexia, and arrhythmias. So do remember to avoid high-fat and high-calorie meals while consuming levodopa. Pyridoxine and high vitamin B6 food such as fish, avocados, and bananas should also be avoided as they can decrease levodopa's effectiveness. Alright, let's move on to anticholinergics. For example, estropine, trihexyphenidyl, and orphanedrine. As the name anticholinergic suggests, it restores the imbalance in the dopamine-acetylcholine system by blocking the cholinergic transmission. So yep, it balances the system. However, it is rarely used due to side effects such as dry mouth, drowsiness, constipation, and blurred vision. Patients are advised to take sugarless candy, melt bits of ice in the mouth, or use a saliva substitute for temporary relief of mouth dryness. That's it for pharmacological treatment. Moving on to the non-pharmacological treatment, let's have a look at the physiotherapy, that include stretching and strengthening exercises, gait and balance training with the use of cueing techniques. It maintains and improves the levels of function and independence, which will help to improve a person's quality of life. Next is occupational therapy. It is a rehabilitation technique that helps to maximize functional capacity through lifestyle adaptations and possible use of assistive devices. This may include assessment of safety in the home environment, such as installation of grab rails and shower seats. Followed by speech therapy. It is also a rehabilitation technique used to strengthen speech for improved communication. It may reduce the risk of aspiration by improving the efficiency of swallowing. While for alternative treatment, it is recommended for people with Parkinson's who have not responded well to medications or who experience significant side effects from their medications. It included deep brain stimulation or DBS, ablation, and acupuncture treatment. For deep brain stimulation or DBS, it involves implanting small devices called neurostimulator that are connected to electrodes to deliver electrical impulses to targeted areas. Neurostimulator act as an electrical impulse generator, which is implanted under the skin near the collarbone to help to regulate abnormal activity in the brain. However, DBS only helps to relieve the symptoms, not cure or stop disease progression. Next is ablation. It is an effective treatment option, but it is not suitable for everyone. It is a minimally invasive surgical procedure that uses heat or cold to destroy damaged or diseased tissue in the brain. During the procedure, a small lesion is created in a particular area of the brain that is responsible for the symptoms of Parkinson's disease. What about acupuncture treatment? It focuses on clearing heat, wind, and phlegm, strengthening and nourishing the blood, and getting the qi, or the root problems, moving smoothly again. Wow, it seems so complicated after listening to those medications. No worries, here are a few essential and simple takeaways to prevent or slow down the progression of YOPD, so make sure to stick with us. By simply exercising, the risk of young-onset Parkinson's disease is significantly reduced. Studies show that increased physical activity, especially aerobic exercises, such as swimming and jogging, relates to improved processing speed and attention. This is because our heart rate increases when we jog, for example, and the blood is pumped to the brain tissue to build up a protective mechanism, thus preventing or delaying the onset of YOPD. Secondly, we can ward off YOPD by consuming a balanced diet. For instance, the Mediterranean diet. Let's break down the components of the Mediterranean diet to help you understand better. Olive oil is a source of fat, which can help to improve cholesterol levels. Next is fish, such as salmon or tuna. The common ingredients used are rich in omega-3s, improving our cognitive function, such as reasoning, learning, and concentration, as well as our cardiovascular health, thereby lowering the risk of vascular Parkinsonism. The Mediterranean diet is also rich in whole grains, vegetables, legumes, fruits, nuts, and seeds, which consist of phytonutrients that can reduce amyloid accumulation and protect our cognitive function. Last but not least, garlic used in the Mediterranean diet has brain-boosting properties, which can help to protect against neurological dysfunction and signs of aging.
What an insightful exposure to us by Mr. Q. Before we end this, I hope that everyone can remember this quote. Young-onset Parkinson's disease is irreversible, but you can live with it with optimism and hope. This is Medical Spotlight, and thank you for watching.